Hello, everyone. Welcome to a new episode of the podcast brought to you by Aneeq, the men's health platform, where we discuss men's health, dealing with hair care, skin care, and also performance. And this episode, we're going to be focusing on the first, which is basically the hair care. Now, as we know, 50% of men, by the time they reach the age of 50, start having some form of hair loss. And for us to take us on a journey and to explain basically what kind of that entails is none other than our guest today, Mr. Abdellatif Adwan. How are you, Abdelatif? How are things?
Hello, Dr. Hassan, and thank you for having me in this podcast.
It's a pleasure having you, Abdelatif. First of all, I would like you to introduce yourself, tell us what you do, and then we'll take it from there.
Indeed. So basically, my name is Abdellatif Adwan. I come today here from the lowest point on earth, if you don't know.
The lowest is probably the Dead Sea, is it the
The
Dead
Dead
Sea?
Sea area, exactly.
Good.
Dead Sea in Jordan, but I have been living in Dubai for the last almost 11 years.
Okay.
What do I do? I'm a marketeer by grade. So basically, I work in the healthcare industry.
Hmm.
Responsible for the marketing, but also on the other side, businessman. I have my own brand. I have also some, I would say, presence on the social media, doing some, trying to influence men's health, and specifically, and also overall, I'd say adventure lifestyle.
Yeah, you're like a person who's like I would consider a jack of all trades. You're like pretty much everywhere. But as you mentioned, given the fact that you are a public person, you know, having the looks is important for you. And since this episode is mainly going to be talking about hair, how is hair important? First of all, as a person, as a man.
It is quite important, especially, I mean, whether you are a public figure that you are doing a lot of shoots, media, etc. You are already in front of a camera, or you are someone who's having day-to-day activity where you go to the work, etc. But I think the hair is very important because it's for men one of the main elements of the look, the appearance that can be game changing for them, whether they are bald or whether they're having full hair with a style. It's one of the main elements actually in their face that attracts the first when people look at you.
Hmm.
Also the beard, the other things, and the face.
Okay. And so it is important. I'm
Yeah.
glad that you've set the tone, and I think that's very, very important. A lot of people don't think it is because hey, listen. We're very comfortable with our skin and so forth, but it is important. Hair care is very, very important. And as a matter of fact, a lot of patients who come in who suffer from hair loss, it really does affect them psychologically. They feel that their confidence starts becoming a little bit lower. They cannot be in public because they start losing their hair. They start noticing that there's space in their scalp. So you have a journey for us. We need to kind of identify that journey. So what happened to you? So tell me a little bit more.
Maybe I'll share with you the moment that I said I'm gonna do it.
Yeah.
Let's say
Well,
that.
well, before that,
Ah,
you've probably know. So before a person does the procedure, which is a hair transplant, let's put it out there,
okay.
but you've probably have noticed that you were losing hair.
Yeah.
How old were you when that happened?
I think it started back in when I was 29. Now today I'm 34, turning 35, but it started around the age of 28, 29,
Okay.
where I started not gonna say hair loss, but my
Thinning.
receding hairline.
Yeah, a
So
receding hairline.
basically,
Okay.
receding hairline started being appearing more and more in my head towards I'm aging between 29, 30, early 30s, till I reach 34, 35. And the moment it happened, how it for me it appears that I start realizing my forehead is going bigger and bigger. And this is
Okay.
in the photos actually.
Yes.
When I'm taking some photos, I realize that it is getting even worse and worse. And looking at my family history, whether from my father's side or from my mother's side, they have a quite good
Uh,
history with being, I would say, hair loss or receding hairline.
okay.
So for me, it was maybe I can prevent this from happening to be worse. Let's start with the first one, talking about the journey with a PRP treatment.
So you started going, hey, listen, I've got some receding hairline.
Yeah.
I need to see somebody. So
Yes.
you saw, I'm assuming, a person who does a
To
lot
see
whose hair. You saw
dermatologist.
a
So I went
dermatologist.
to
Okay, I'm
dermatologist
glad that you saw a
directly. No, no,
dermatologist, which is
dermatologist
really good.
directly. I went to dermatologist. I have a consultation.
Okay.
So I did the exercise. I was reading about the topic, and definitely the moment you Google it, receding hairline, hair loss, you start having hair transplant Turkey. You know these kind of like on
Yes.
Google,
Yes.
which I don't think it's the
Yeah.
best
Yeah.
platform to start with. However, it says let's start with the consultation. Let's gain some knowledge about it. And here where I went to first consultation with a dermatologist, and she recommended let's have a PRP.
Okay, so immediately she recommended a procedure to undergo, which
PRP would be the best solution for me after doing consultation. And to be honest, I did it with another two
okay.
dermatologists, not only one, and also word of mouth because I spoke with other friends who did PRP. So I was more validating the topic before taking any decisions, I would say.
Got it. So I just wanted to explain to the audience here is that PRP is platelet-rich plasma,
Yes,
and what happens is that they would draw blood from you, they would centrifuge it, and then they would inject it in
in the
areas that
scalp.
of the
Yes.
scalp, which is basically that's receding. So in addition to the PRP, were you given anything to use at home? Because
There is
there
some
there
hair,
are different treatments for
yeah,
that.
some hair tonic was given. I mean, some recommendation about the shampoo, not to use it, conditioner,
Hmm.
etc. But maybe for people it was effective with the results they are happy with, but for me it wasn't what I wanted.
Okay.
And
You,
that's
you did
what,
not want to apply something on a regular basis.
yeah, I mean,
Okay,
applying it on regular basis, whether if there is certain shampoos, I mean, without chemicals, etc.,
I see.
organic ones, having a hair tonic, minoxidil also is one of the
Exactly.
sprays. But to be honest, from experience, I would say, or what I read about it, I'm not a big believer with sprays.
Okay.
This is my own, I would say, opinion after reading about them, trying them. Where I wanted the specific results that it will not come, but I doesn't mean that it won't work for anyone.
Right.
Because
But
my brother actually is using minoxidil and it's working
no,
for him.
is he using the minoxidil topically, like as a solution, or is he taking it orally
No, no, he as a spray. He's using
as
it
a
for now.
spray?
Yes.
Okay, because there are there are pills in which they contain minoxidil that can actually also work.
Yeah.
So you never thought about taking them?
No,
No.
to be honest.
Okay. How about the other medications? There are certain medications such as finasteride, which is, hormonal. It affects pretty much the changing of testosterone to its active form. So you also did not want to take that.
To be honest, I'm not a big fan of medications.
You're not a big
I
fan of
mean, I
medication?
say I
Okay.
would rather go with I would say natural way. Some people they like to have medication, but because for me, looking at the side effects, playing with hormones, it wasn't something really I was keen to do. So I
Uh-huh.
looked maybe more towards having a permanent solution and something that give me results, but without really trying to affect or play with my I would say hormones or in
Okay.
vital I say uh, hormones in the
So
body.
so you did the PRP, you were dabbling basically on the minoxidil sometimes, sometimes you didn't. And then, it hit you, you said to yourself, hey, listen, I need to get a hair transplant.
Yeah, and it hit me exactly. There was one time after I finished my run, happy about my run, running with everyone, and then let's take a selfie. I took the selfie, and when I look at myself, I cannot see my hair. It's just forehead, you know. When you
Ugh,
take the selfie, you will be the one, especially if you're the one, you will be the one looking up.
yeah.
And I end up saying like, here where I realized that my receding hairline is quite obvious,
Okay.
and I need to take control of the situation.
Now, is it because you thought the receding hairline, or is it when you made aware of it? I mean, it wasn't like, you were involved with somebody, they told you, hey, listen, you need to kind of, I don't like the way that you look. You're looking old. You're not looking your age, which is the age of 35, I guess.
Actually, no, it wasn't someone telling me that, but it was myself actually
Yourself.
looking. I mean, every day, it was obvious. And when you look at it, especially when you want, let's say, in the morning when I do my hair, I want to put it at the back. I'm putting it, but I'm seeing it's quite big. I would say gap area, and I can see it. And to be honest, thinning hair also
Yeah.
start coming because
Yeah.
receding hairline it doesn't just start like this.
Hmm.
You will start having your hairs start to be thinner and thinner till it falls, and when it's dry you see like it's a very weak hair, and it's
Yeah.
very obvious for you when you look at it in the mirror or when you want to do a hairstyle. So I said like no, I think it's getting worse and worse, and yeah, I need to be in control of the situation.
Awesome. Okay, so you decided to do that, and then I'm sure you did your research on where you wanted to do it.
I did a huge research,
Uh,
and I would say to anyone, do your own research. Don't listen, I would say, to anyone or any recommendation. No, no, do your research. So I did my research about clinics.
what is it that you look for when you're doing your research?
I was looking for a certified surgeon, someone certified, because there is a lot of people,
Yeah,
now doing it, but they're not certified surgeons
absolutely.
or doctors.
Hmm.
They are even not even nurses. And to look for something with good reviews. So someone who's not being having a good customer reviews, I wouldn't consider. And the third thing, it has like proven success record, a track record of hair transplant surgeries.
Yeah.
That I want to see that what is the impact he did for the patients, before and after. So I had to see a couple of things. Also, when I did my research, as you know, the biggest country or the number one country for hair transplant is Turkey. However, for me, I wasn't really feeling comfortable to do it in Turkey because of whatever happened afterwards, aftercare. I need to be feeling I'm close and I can sort it out. So I decided to do it in Dubai.
Okay.
And here also I did my exercise where I looked for different clinics. I went to see consultation with every single clinic. I looked at with the customer reviews, and then I did it with the hair clinic Dubai in Al Wasl, where I sit with the surgeon a couple of times, not only one time. And what I like about it that they don't tell you like, let's do hair transplant from the beginning. No, you have a hair consultation and they give you recommendations. They might tell you, let's try this. Let's start with this, for example, oral medications with, let's start with the sprays, hair tonic, etc. So PRP, they give you different solutions, but they will also be honest with you what to expect, right? So if you are expecting to be in control of the situation, not to be more bad or having more receding hairline, then PRP maybe it will be good to maintain. But if you look to restore your original hairline, no, you need to do hair transplant as
That's
a
true.
permanent solution.
Yeah, that's true.
So we had a nice conversation. I shared my concerns. They answered all the questions, literally all the questions, and they give detailed information. And that's what made me comfortable to make the call.
Okay, so you made the call, you've got the appointment right now.
Yeah.
So what were the pre-operative stuff that you did? I mean, did you have to shave?
Yeah, it was a quite interesting, I would say, journey. For me, also in the clinic, when I looked at the solution. So what I liked about also Hair Clinic Dubai, they are using the latest FUE,
Yeah,
bioenhanced
yeah.
technology, FUE. Um,
Which
where,
FUE is follicular unit extraction. So we
yes,
just wanted to explain that
sorry,
to everybody. That's fine. It's okay.
I've been doing the exercise, reading about all the methods. It's quite good learning, actually.
Hmm.
So on the day, I will be honest, it was straightforward. They shave your head from the back where they want to take the hair follicles, and then they little bit clean the area for the hair transplant, which is, for me, it was my forehead. And following that, they will apply a local anesthetic to your scalp, where the area where they're gonna take the follicles from and where they wanna implant the hair afterwards. Um, it was painless journey, to be honest. Uh, Also, to be honest, the downside, it was 7 hour surgery. It was quite long one.
Wow.
This is the downside of it. Painless, super pain. It's a painless surgery. You will not feel anything about it during the surgery. So finishing it after 7 hours, it was good. Um,
And you went back home, your head is wrapped?
yeah, they
Okay.
wrapped my head with a white strap
Uh-huh.
above in my forehead. I went back home. I would say the first 7 days were tough. I mean, for someone who is very active at exercising, this also was one of the, I would say, things that made me a little bit hesitant that for 4 weeks, I cannot sweat or do heavy
Yeah,
exercising.
yeah, yeah.
So I need to kind of like stop running, stop exercising, playing favorite sports for one full month. I cannot sweat. I need to maintain it. So this was a bit makes me feel a little bit like So I need to be also I would say
It was a little
cautious about it.
restrictive in a sense.
Yes, there is some restrictions, especially for active people.
Exactly.
The first, I would say, 7 to 10 days, it was tough ones, and this is also to be honest with everyone, because when you
No,
sleep, you need to have elevated head.
yeah, so it was restrictive in a sense that you were not able to do things, but at
Yeah.
the same time also restrictive because you have to be very careful because they just put the
Yes.
the hairs in.
And the thing is, the follicles are very sensitive when they put it
Exactly.
in. You need to
Yes.
make sure, because I mean, all the hard work, it can be ruined
By
if you
you.
are being careless.
By
So the
you.
post-care and also the clinic and the surgeon will be very clear with you with the post-care. It
Hmm.
doesn't like for you when you leave, goodbye, good luck. No, no, no. They will be pleased as you, even by the way, with the pre-care, like not drinking coffee, etc. They will be very specific with you what not to do before, what will happen during, and what will happen after as a post-care.
Okay.
And the good thing about the post care is you need to be very, 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 very careful. As I said, because of the hair follicles, it might fall quickly if you had a hit or a bump quickly on your head, but also when you sleep. So I was using when you travel,
Yeah,
the
yeah,
neck,
you got
the
to put like
pillow, the one
a
around
neck
your neck.
brace. Yeah.
So I having it, I was sleeping like almost sitting like incline position.
Oh my
It
God.
wasn't the most comfortable
Uh-huh.
way, to be honest. But after I think 6, 7 days, things got better and a little bit the swelling in my head. I want to
Yeah,
mention
sure.
it.
Yeah.
That was quite also. I didn't. The surprising moment of the surgery was, I think, 3, 4 days after the surgery, where I didn't recognize myself in
Yeah,
the
because of the
mirror,
swelling.
swelling, but it was okay with the journey. So if anyone I'm asking, I'm telling anyone who is, let's say, working, having full-time work, you just need 1 week to 2 weeks leave. Even you can consider it during summer or
I see.
during off season where you can do it, or you can connect virtually. Because I was doing my work, you can operate, by the way, from the second day. You can have calls, work, etc. But you need to make maybe 10 off the camera for the
Mhm.
first week, not to be shown, but you can perform easily. There is no any distraction, I mean, from your side that you need to worry about.
Yeah, after the procedure is done, you mentioned the swelling and so forth, but the hair follicles are also very sensitive. A lot of people experience shedding,
Yeah.
so that the hair starts to fall in the beginning, and then they get scared. They go like, "Oh my God,
And that's
that's,"
normal. That's very, very,
and this
very,
is something that we wanted to
yeah,
tell people.
very, very normal. And to mention that if you look at the cycle, so after 2 weeks, you start seeing the hair growing a little bit, some of the hair,
Yeah.
and some of the hair will fall. And that's fine because the hair, it has also their own cycle,
Hmm.
right? And for the first 3 months, all of the hair that you put will fall,
Yes,
and then the new hair will start coming from the follicle. You don't need to worry about because the
absolutely.
follicle is there inside your scalp, and you need to make sure it's healthy. And one thing I would recommend for anyone doing the hair transplant, please do PRP during that period, starting from the first month after the surgery, because it will really enhance the result big time.
Before or during?
No, no, during. So after the surgery, by 1 month, I
Ah,
was
okay.
doing it
All
every
right. So I
month.
see. So after that, you came to PRP.
For the first 6 months post surgery, I
Okay.
was doing every month PRP, and then I stopped, which I think it was a
It does. I mean, I agree with you because PRP plays a huge role, first of all, in the the hair growth, but at the same time also in wound care and wound healing.
yeah,
So during the whole process of that the way that the scalp is healing, the hairs are coming back. So doing PRP really provides the groundwork,
yeah.
so that it allows the hairs to kind of go back to their normal cycle again. Now the question is that were you told to kind of use minoxidil or anything else during this time? Because some people
D-
do.
During that time, the recommendation was beside, let's
PRP.
say, the PRP, is to have a hair tonic.
That's it, just a
So
tonic.
putting, yeah, hair tonic, and nothing else was recommended. It's just you need to make sure that you take care of your head. I mean, the food, the sleep, as a recovery for you to really get your head or the hair follicles to grow in a natural way.
So how long did it take you from the first time that you've done the procedure with all the stuff until you are able to kind of brush your hair in a nice, normal way?
4 months.
Just four
Yeah,
months.
from the I mean, after the second, third month, your hair will start falling,
Yeah.
which is normal cycle, and
Yes,
then it
yes.
will start growing again. And one thing what I did, I didn't shave my whole head, by the way. So what I did is I shaved only from the back,
Uh-huh.
and then when they took the hair, I kept my hair here, and then I shaved from the front.
Yeah, because you just wanted the hairline.
Yes.
Okay.
And then when they did the hair transplant, I was even putting my hair forward. I was having cap.
I
But
see.
after 2, 3 months, I was shaving like my hair very short. It wasn't appearing.
To kind of balance out the
Exactly.
different
And after
lengths.
actually 2 weeks, I made a fade from the back and it blended everything. And now even you cannot know from the back I took
The
any hair
extractions were
follicle.
from the
Yeah,
back, so that nobody can tell.
nobody can tell.
It's a wonderful job. I mean, I have to say.
And this is, by the way, today I'm marking, I would say 8 months post
Eight
surgery.
months.
Yeah,
Okay. So after this was done, and you knew that, first of all, how, in terms of percentages, I mean, how successful are hair transplants?
I would say 80, 90%.
80 to
Yeah, yeah.
90%. And they're permanent, as you said.
And they're permanent as long as you take care of it.
Okay.
And I need to be very specific that about the post care, because post care is really important, because once you do it, you need to maintain it.
Mm.
Because don't forget, I did the hair transplant, right? But still, I have receding hairline in the middle coming backwards.
Exactly.
So I need to maintain that, and this maintaining it through PRP, through hair tonic, that you need to continue having this hair care to not to waste really the whole hair transplant. And actually, by the way, when I did the hair transplant, I asked him even, and it was an agreement, is to fill also between the
The
hair,
hairs.
which is coming, that we expect that it will be receding
Right,
afterwards.
right. Yeah, I mean, I gotta say, I mean, hair transplants have gone a long, long way since like the first were done. I mean, if people remember the first hair transplants, they looked like dolls'
Yeah.
hairs. I mean, they looked funny. And it's because, not a lot of people, know this. You probably know this because you've done your research, but everybody here who's listening is that the hairline, the hair follicles themselves are individual. And as you kind of go backwards, they become two. And then as you keep going backwards, they become three and four.
Yeah,
And if you start removing hairs that are three or four from the back and bring them up to the front, it doesn't look very good. It doesn't look very natural.
100%.
So you have to go to the right person. Now the question is that so there was one point in your life when you just before you decided to do the hair transplant where you were feeling less self-confident. You were looking at your receding hairline. You're going like, what's going on? My selfies look all wrong. And then 8 months after, now you're looking at yourself and you're taking a selfie. What is it that you tell yourself?
I'm proud of myself. I will be honest. I mean, if I tell myself something, I do it on every day is like how you improve yourself, right?
Yeah.
So if you look at self, when you make calls or when you make decisions, especially like big ones, like for example, hair transplant,
Mm.
you'll be a little bit hesitant in the beginning. Is it the right one? What if it went wrong? You know, it's in your appearance. It's not something that you are playing with that it can be hidden or it can be undo afterwards. But to be honest, again, after 8 months, I think I'm quite happy with it.
So what would you tell people, for example, who would come to you and say, "Hey, you're so vain." I mean, it's not just about the physical appearances. Well, what do you tell them?
I would say it's easy to say it's a vanity, especially when it doesn't affect you, right?
Mhm.
If you have a good hairline and you're doing good with your hair, if it's not something within your interest, it's easy to say it that way. However, how I see it, it's how to improve yourself, same as exercising. So if you look at to improve your health, you look to stay young, right? This is the
Absolutely.
aim. So the
Mhm.
same thing with your hair. So you're also aiming to stay young. Everyone is aiming to stay young, whether health-wise, look-wise, with big respect to the age. But at the same time, it's another form of self-care that you look at, same as exercising.
I agree with you because I mean, if you boost your self confidence, even people would say, I mean, listen, I mean, you're just doing it from a physical point of view.
Yeah,
It really affects how you look at yourself. You become more productive. You become more active in your daily life. So it is very very important.
it is. And look at the gym also. When people, let's say, having someone overweight, they will not be happy. They will be like hiding, etc. But look at someone who's going to the gym, having six packs, having a great physique. They will be overconfident. And by the way,
Absolutely.
confidence starts from the gym or the people
Yeah.
try transforming their body. I mean, I have a huge debate with someone about, let's say, if you have a good physique and you have a self-confidence. No, self-confidence, it goes up with a with a good physique at the end of the day.
Hmm.
And if you look at the people when you want to compare, you will never find someone with a great physique and very low
Self
confidence.
confidence.
No,
Yes.
no, it's impossible. They work together. And the same thing with your look.
And this is very important. And this is a message that I really want to go across because people think that men should not care about themselves. They should, men are there to kind of work hard to, do this. But it is very important to educate people that looks really are important.
I will tell you something. To be honest, if the man takes care of themselves, yeah, in a good way, self-care, whether their health, their physique, their look, etc., they will feel way much better and they will perform much better to take care of their loved ones,
Hmm.
right? Because if you need to be at your best, you need to feel the best, right? Back
Absolutely.
at home, if you with your wife, with your kids, you need to make sure that you are feeling your best. And you're feeling your best by going to the gym, taking care of your health, taking care of your look. You are feeling great. You perform better at work with people, with your business, and will end up being really providing for your family and doing great job back then. So it starts by taking care of yourself. If you don't take care of yourself as a man, how you can take care of other people?
I agree completely, and I like that. I like the fact that you kind of pushed for this because this is something that is considered to be more of a taboo here, especially in this part of the world. I mean, because we were always brought up as, hey, listen, we're supposed to take care of our family no matter how we look.
Yeah,
Whether we've got a big, belly, whatever, whether we don't take care of ourselves or we're disheveled. But at this age, especially, the competition and so forth. I mean, I think, you know, looking your best really allows you to be your best.
yeah.
Yeah. So, Abdelatif, I usually like to end this with like, the guest telling me, three very important kind of, or three major points that is going to resonate, hopefully, to the audience? What are your 3 points?
First point is if you're gonna do it, for example, the hair transplant, do it for yourself and
Okay,
don't do it for anyone else.
I like it.
If you're gonna do it for other people, no, please don't. Just do it for yourself. Second point is do proper research, and please do proper research to make sure what you pick, what you decide on, it's the right thing for you. Because, for example, hair transplant was a good call for me, but for you, maybe it will be
Something else.
the spray or the oral medication.
Hmm.
So there is no one size fit all or one solution for all. So it doesn't mean that Abdelatif did the hair transplant. It means we need to do it. No, do the consultation and see what's the best for you.
For you. So, and you need a place where you can actually get the best resources and, get educated in that area.
Yeah,
Okay.
100%. And the last one is what I already shared is you need to take care of yourself to be able to take care of others. And this is by looking at your hair, your appearance, your physique, your health, your nutrition. When you are at your best, you can perform at your best.
Fantastic, Abdelatif. Thank you so much for being our guest here.
Thank you so
Thank
much.
you.
Thank you for having me.
Thanks.